Dr. Lebo, Gyno. We have a touch-up surgery today, 52-year-old from South Jersey, who I did about a year ago. Actually, he had 2 previous gynecomastia surgeries, not from me, probably about 12 years ago, and again about 10 years ago from a plastic surgeon in Jersey, and I fixed him up, and now he wants more. He wants more better, which I'm happy to give. This is what he looked like before my surgery, but after the botched gynecomastia surgery, again done 10 and 12 years ago. See the indentation there? He had lipo, he had gland removal, no really definition of his abdomen. Let me just see where that is. See the indented nipple there. See the indented nipple there. We did do pectoral lipofilling. I put in 240 cc's in each pec, and he wants a little bit more just to make it pop out a little bit, especially under the nipple areola. See the indentation there, and also really no definition of his abdomen whatsoever. Now today, he's got the 6-pack abdomen. He wants me to clean it up a little bit more, the midline linea alba, the semilunaris, the V to P, and also go a little bit more over here. I shouldn't take out too much, otherwise you'll start seeing the muscle underneath there and start having irregularities. Lift up your arms, look at the serratus muscles that I gave him. Look again. This was the pre-op, turn a little bit on the side there. The nipple looks great, but I'm going to put a little bit more fat grafting in there. The serratus muscles, and even the flanks. Look at the fat in the flanks there and there, and we even that out nicely. He's got no fat here. But today, if we turn you around, we're going to just kind of, because I need more fat. He doesn't have much in the front. I need more fat for the pectoral lipofilling, and we're going to get some fat here. If we have enough, we'll put some in his delts. We will see that. But we're going to make a stealth incision in the intergluteal crease. Get here. He doesn't want the mid-back. He doesn't want an extra incision there. So really, from the we're going to continue the definition of the lats back here and get all of this, the central diamond, the venous dimples, and etch the upper butt and lower back in there. Clean this up a little bit more out here and get that deepen the V to P and deepen this. And finally, stealth incision in here to put a little bit more fat into the lower pec so that I pop this out even more, all under local anesthesia. So from here to here, and even better now, Lebo Gyno, 631-424-0101, or email me at jonathanlebowitzmd@gmail.com. Let's go. Suck that in. We're going to deepen that. Deepen that. A little bit here. All right. Suck in your belly. Deepen that. That. You got it? You got it? You got it? Just make an incision there, there. Leave that alone. If you want, I can deepen that a tiny bit, but let me be careful. Good. Nothing over there. Nothing there. Leave the lats alone. All right, now flip over. Okay, come on. Midline. Paraspinal muscles. Central triangle. Venous dimples right there. Right now. Across here. Come across here. That a little bit. That a little bit. The lats. The lats. Okay. No incision up there. Tighten up your butt muscle. Good, man. Maybe get this a little bit here. I'm doing that lately. Lift up here. Don't want to go too much here. So there you go. Let's see what I'm doing here. Boom. Good. wants more, but he wants to be careful.
Oh, you were just going to comment on it.
Yeah. I don't want to do anything here because I like the serratus muscles and stuff. I like all of that. I don't want to mess that up.
Let's begin by introducing ourselves. I am Han of Dime France, and we want to pump you up.
Seconds. You all right? All right, so this is just fine tuning everything. And we're gonna add the back. Just the lower back on him. He doesn't want to do the back. Okay. All right, guys, so now we're lipoing. I want to create good, perfect. You all right? A little male cleavage. Good. Sorry about that. Alright, so we're getting the midline better. Alright? Yeah. Good. All right, so here we are. So now I'm in the groin. Got old hernia incisions right there. Going below that so I can really get the feet to pee. And he wants me to empty this lower belly even more. I warned him against doing it too much, but he said just do what you think is best. And that's what we're going to be doing. Lebo Gyno, so I'm filling right here. So that's where he had 2 surgeries in Jersey before me. And really I did lipofilling 240 cc's in each pec. And he really did great, but he's got a little bit, he wants more there. So he harvested some more. So he got a little bit numbing right there. Get underneath that muscle, give me a second. Slowly but easily. Now this is gonna live because it's in the muscle. There we are. Right. You right? There we are. Now let's fill this up nicely. Gyno finishing up this beautiful case in his front, wait for the back. We did additional sculpting, Vaser high definition, power assisted liposculpture, mainly of his lower abdomen. He wanted less of the less fat in the lower abdomen. Wanted me to really kind of contour that, but we're doing 360 around, and the lower back stealth incisions in the belly button and in the groin. We got an additional 2 liters out, 1 liter in the front, 1 liter in the back. We got out. And we did some more pectoral lipofilling. We put an additional 120 cc's in each pec. Now, he had prior surgeries ×2, so they went in twice in this, and I'm going to fix that up a little bit later. But look at this right side. Look at this great pec muscle. The pec muscle there, and the negative space between the lats and the pecs. Stealth incision in the armpit. No incision by the nipple. This is what I'm talking about. Same thing over here. He looks great. Make a muscle. That looks amazing. That great shape to it. And we defined the midline linea alba, the semilunaris, the V to P, all the way to the side to the hip. So this is Lebo Gyno and beyond, standing by my surgery, because I operated on him about a year ago. But remember, he had 2 surgeries before me, like 10 and 8 years ago. And I fixed everything up, fixed the botch surgery that he had. And he looks great. I think this is the final procedure he'll ever need. And we'll take out the drains in about a week. So if you have gynecomastia either by me and you want more, you call me, or you had it by somebody else and not thrilled with the results, you call me. Lebo Gyno and beyond, Dr. Lebowitz 631-424-0101, or email me at jonathanlebowitzmd@gmail.com. Follow me on YouTube and on Instagram. I have 2 websites, Lebowitz Plastic Surgery and Long Island Gynecomastia Center. Long Island Gynecomastia Center. Like, subscribe, comment, whatever, and I'll get back to you with anything you write. And if you need me, you call me for a video consultation. Again, 631-424-0101, or email me at jonathanlebowitzmd@gmail.com. Let's go!